Welcome back to Living Local. The National Alliance on Mental Health reports 1 in 5 adults and 1 in 10 young adults between 18 and 25 experience mental illness every year. At least 50 million Americans are grappling with mental health challenges, and today we are highlighting what experts call a mental health crisis and what help is out there. And joining us in studio is Dr. Whitaker in this segment sponsored by Vera French Community Mental Health Center. Thank you so much for stopping by again.
You're welcome. It's great to be here.
So it does seem like the whole country is talking about mental health right now. Is mental health having a movement right now?
It's definitely having a moment. It's such a great time right now because people are recognizing that people have things going on in their lives, that their friends, their family members, they themselves are struggling with mental illness to some degree, anxiety, depression. It's not what it used to be. There's maybe a change going on.
Yeah, for sure. How do you think, some of these recent incidents of mass shootings relate to the conversation around mental health?
I think it's really important that we distinguish between mental illness and dangerousness, because dangerous people do some of those mass shootings, and maybe a few of them might have a mental illness. They're definitely twisted in their thinking, but it's not necessarily a mental illness for most of them. Mentally ill folks are not dangerous. In fact, they're more likely to have violence perpetrated against them than they are to actually be the perpetrators of violence by a vast margin.
Yeah, that's interesting, because I think a lot of people look at these shootings and they think it's mental illness. It's mental illness.
Right. No,
yeah.
it's just criminality and it's dangerousness.
Yeah.
But there's definitely a distinction there.
So you are involved with an organization called the National Council for Mental Wellbeing. You were actually just in Washington as well. What's its purpose and how has it improved services for funding of mental health?
So as a board member of the National Council for Mental Wellbeing, I had an opportunity to talk to legislators and to talk to other leaders from across the country about mental wellness, mental illness, what we're doing on both fronts. And the National Council is really about advocating for the mental health of our country. It's recognizing that there are gaps in our services. There's a need to be more integrated, and right now, yes, mental health is having a moment, and there's need for additional funding to make sure that we've got the services people need.
Yeah, and it seems that mental health, is seen as important, politics aside. How did this happen, and does it mean the stigma around mental illness is going to go away?
One of the maybe more positive results of the pandemic, if there are any positive results, was the fact that people recognized that mental illness is more common than they thought.
Yeah. And
that something like a pandemic can bring on anxiety and possibly depression with the isolation involved and all of the uncertainties. And so really both sides of the aisle, the Democrats and Republicans, everybody, regardless of what they believe politically, can get behind the idea that my family members, my friends are struggling, and maybe me personally, we're struggling with these issues, and we need more services to help.
Yeah, I think more people are starting to realize that mental health is just as important as physical health now. And the burnout is very real. Don't you see that?
We do, yeah. People that are working in healthcare in general are working longer hours and seeing more people, and we are seeing more people coming in to Vera French, for example, to get help with their mental health concerns.
Well, that's great. At least they're, that they can recognize that, or someone can recognize that. Let's talk a little bit more about your trip to Washington. What else did you learn?
Well, one of the great things that's coming up soon is a national crisis line number, 988. Similar to 911, where you call one number and you get help. 988 will be a crisis line for folks with a mental health crisis, or a mental health emergency, or just the need to talk to somebody. And that one number, 988, will allow them. That starts on July 16th, actually.
Coming up. I love that. I love that. So important, too. And hopefully people will use that as well.
Right, and then that number will connect back to services.
Yeah.
There'll be referrals back to services like Vera French offers. So.
Excellent, excellent. All right, Dr. Rich Whitaker, thank you again for coming in today.
You're welcome. Thank you.
Again, this segment was sponsored by Vera French Community Mental Health Center, and to learn more, you can check out verafrenchmhc.org.